y'all are on video. Here's my audience. Okay, so Alright. According to the Anxiety and Depression Association of America, 6.7% of the United States population above the age of 18 experiences depression in a given year. The medical community has made countless antidepressants to help people overcome the mental illness, but still somehow thousands fall victim to depression-related suicide every year. We live in a day and age where depression is common enough to have a commercial for antidepressants during almost every commercial break for every television show. Towards the end of every commercial promoting another medicine, the speaker lists a set of side effects one might experience from the medicine, among which thoughts of suicidal tendencies are always listed. With an overwhelming number of symptoms to identify when someone falls into depression, there is still countless people losing their lives. And despite what some people may think, there are in fact notable differences in men and women that experience clinical depression. Why do companies advertise antidepressant medicine that has a side effect of suicidal thoughts? There are a number of symptoms that are shown as a sign of depression. These include a persistent sad or empty mood, a feeling of hopelessness, guilt, or worthlessness, a loss of interest or pleasure in hobbies and activities, a decreased feeling of energy and increased fatigue, difficulty remembering, making decisions, or concentrating, insomnia or oversleeping, low appetite and weight loss, or overeating and weight gain, thoughts of death or suicide, restlessness, persistent physical symptoms that do not respond to treatment, such as headaches. According to WebMD, one must experience 5 or more of those symptoms over a period of 2 or more weeks to be classified as clinical depression. Only 5 symptoms. Right. According to Healthline statistics, 20% of people with major depressive disorder develop psychotic symptoms, and 10 to 15% of women develop postpartum depression, and that can all be found on Healthline. Men think that they have to be the tough guy that doesn't show any emotion, and in some respects this is accurate. Men distract themselves with activities when they feel low, unlike women whom dwell on the negative. Men also have a track record with substance abuse, such as alcohol and illegal drugs prior to the onset of depression, especially in teenage boys, whereas women experience substance abuse during the depression. While it is much easier to spot depression in women, according to the ADA, men project anger and irritableness and are therefore more likely to commit suicide due to a lack of notice of men's depression. All of the differences I've just stated and more can be found in the article in Live Science. Serotonin is a chemical in our brains that is associated with the feeling of happiness. Common antidepressants include Cymbalta, Prozac, and Zoloft. All of these are selective serotonin reuptake inhibitors. That just means that the drug will block neurotransmitter receptor sites so that serotonin can reach the sites and be absorbed into our nerves. As I said previously, most antidepressants have a side effect where one may experience suicidal thoughts, and at that point they should go see their doctor to discuss a change in dosage or a change in the medicine itself. With the number of people diagnosed with depression increasing by approximately 20% every year, according to the ADAA, it is clear that a stance must be taken against the most common mental disorder in the world. 80% of the population with the symptoms of clinical depression is left untreated. That is how suicide rates are so high. If people would take a few moments out of every day just to give someone a high five or tell them they're doing a great job, or even just smile at someone else, it could change that person's life. Just the thought of doing so little to help someone in such an important way should be encouragement enough for humankind. 1 in 10 people experiences depression. Think about how many people are in your family. Chances are at least one of them is currently experienced or has experienced depression. We should want to change their lives.